Hello, my name's Sarah Bland and I'm lead pre-op nurse in Sheffield Teaching Hospitals. This video is aimed at teaching people how to prepare for major surgery. We will not be giving any information about the surgery itself. Prior to COVID-19, we ran a face-to-face patient education session. As a patient, you're on a pathway which you do not have control of. Feedback from patients tells us that by giving you goals to work towards before surgery, gives you back a feeling of being in control. Over the next 30 minutes, you'll hear from Clive Kelty, consultant surgeon, Louise Maxwell, consultant anaesthetist, Nikki Garner, lead physio, Felicia Nicol, dietitian, and Kirsty Allen, specialist nurse in critical care. We will give you lots of information, so please have a pen and paper handy, as you may want to take some notes.
My name is Clive Kelty. I'm one of the consultant upper GI surgeons at the Northern General Hospital here in Sheffield. The presentation you're about to watch is about giving you information to help you to prepare for your upcoming surgery. We understand that this is a big operation and we know that this is a stressful time for both you and your family and friends. But what we are trying to do is to give you more information about preparing for the operation, what you can expect when in hospital, and also during the recovery after you come home. We know that major surgery is not without risks, and there are many reasons for this, including things such as people getting older, having other health conditions, taking different types of medication, and also generally that as we age, our overall fitness and the ability to deal with stressors is reduced. The operation you are about to have is a big one, and it will put your body under a lot of strain. It can take some time to recover from this, not just in hospital, but also in the weeks and months afterwards. The surgery school programme is about addressing changes that can be made prior to the surgery that can significantly impact upon the operation itself and also the recovery afterwards. What we are aiming to do is to address your overall levels of fitness and the ability to withstand the stresses of the operations, as well as the impact of any other health problems that you might have. This can include other things such as looking at your nutrition. This is important because it helps with your immune system, and for example, it can improve your energy levels prior to the operation and also how quickly they recover afterwards. We want to help you to be as well prepared as you can be. This programme will help you to do this, and we have found that making several small and achievable changes can have a significant effect upon the operation and the recovery. This is an opportunity for you to make changes that can have a massive bearing upon how you recover from this surgery.
My name's Louise Maxwell and I'm a consultant anaesthetist. I'd like to take a few minutes to explain to you what happens to your body after major surgery. The surgery places a huge amount of stress on your body and it makes your heart and lungs work much harder in order to pump more blood around your body and get oxygen to the areas of your body that need to heal and recover. In addition to that, the stress of surgery causes your body to break down your own muscles in order to generate fuel. This leads you to feel very weak and tired. Now, nobody would go and do a very long walk, a bike ride, or a cycling race or running race without preparing for it. People would train for it, and the reason they train for it is because if they didn't, the event itself would feel absolutely awful and they wouldn't do very well. Now, preparing for surgery is actually the same as preparing for a major sporting event, in that the fitter and stronger you are before you start, the better you will do. I'd like to take a moment just to talk about breaking bad habits. Now, if you're a smoker, you will have been told at some point before that you ought to stop. And we appreciate that at this very difficult time when you're facing a stressful event, that stopping smoking is very hard to do. So I'm about to explain a little bit about what the risks are as a smoker and what support there is out there. When you smoke, you produce more phlegm and you're not able to clear it as well as somebody who doesn't smoke. As a consequence, you're more likely to suffer post-op chest infections and pneumonias after surgery. If you do happen to have a chest problem after your operation, then you're likely to stay in hospital for 2 to 3 times longer than somebody who doesn't have a chest problem after surgery. In addition to that, we know that smokers are at higher risk of suffering from heart attacks and strokes. If you use a smoking cessation service, such as the one that's advertised here on the screen, then people are 4 times more likely to stop smoking than somebody who tries to stop on their own. Moving on to alcohol, if you're somebody who drinks 1 or 2 glasses of wine or beers per week, then you don't need to worry. If you are somebody who knows that they drink too much, or you drink every day, or drink alcohol heavily on at least 3 days a week, then you really should consider cutting down before surgery, because excess alcohol slows down your recovery because you have more post-op infections and don't heal as well. The third area is not about habits, but we know that anemic patients tend to have longer hospital stays and more post-op complications. So if you're anemic, and particularly if you are iron deficient, then you may need to have some iron tablets, or for some people, an injection of intravenous iron before surgery to boost your iron stores. What you can see on the screen now are the 4 key areas that we're going to talk about during the rest of this video. Nikki Garner, our lead physiotherapist, is going to talk to you about activity and chest training, and Felicia Nicol, a dietitian, will talk about the importance of having a balanced high protein diet. Towards the end of the video, we will talk about what's on offer for anyone who needs psychological support, as we know that people who maintain good mental health also have a better recovery. I'd like to just talk for a moment about exercise and what's available to support you. For those who would like to have a personal trainer to guide you with exercise, then there are several options. One is a clinical trial called SafeFit, which is a collaboration with Southampton University and Macmillan, which is available to anybody who has a diagnosis of cancer. And they will support you for 6 months, giving you telephone support for exercise, your diet, and mental well-being. If you don't have a cancer diagnosis, or you prefer to support your local schemes, then in Sheffield there's a programme called SPARS, which stands for Sheffield Physical Activity Referral Scheme, which you can refer yourself to online if you Google SPARS Sheffield, or your GP can refer you. And there are some online options which make the exercise classes available during that time that you may have to isolate before your surgery. If you don't live in Sheffield, then Doncaster, Chesterfield, Barnsley, Rotherham, they all have their own schemes, which you can find out about either by going to your local leisure centre or asking your GP practice. I'd now like to pass you on to Nikki Garner, a lead physiotherapist who's going to talk to you about activity.
It is important to recognise that surgery is a big challenge for you and your body, and if you train for it, you should recover better. The fitter you are before your operation, the quicker you should recover afterwards. As we advise you to exercise, we encourage you to choose something that you enjoy and try and fit it into your daily activities. It doesn't have to be something expensive where you buy new kit or equipment. You can definitely exercise at home and on your own, but you might find that it's nicer to exercise in the fresh air or with friends. You must start this as soon as possible before your operation, but don't worry if your surgery is very soon. All of this information about exercise is just as relevant as you recover after your surgery. You can definitely exercise when you are self-isolating or shielding before your operation. The World Health Organization recommends that we should all try to exercise for 150 minutes a week. You might break this down into exercising for 20 or 30 minutes each day, ideally with a mixture of that which increases your heart rate but also increases your muscle strength. On the slide, the brightly coloured scale helps us to see how hard we're working. If you aim for the green band, where you're breathing heavily but can still hold a conversation, this is ideal. It is okay to feel breathless when you exercise. Some of the examples we give you could be walking to the shops and maybe getting the bus home. You could do laps of your garden or use the steps in your house to do step-ups. You could also do sitting to standing over and over again while the kettle boils or while you're watching TV. You can use bottles of water as weights when you do upper limb exercises. It might help if you set yourself a timetable or some targets for each day or each week, as this might improve your ability to achieve your goals. There are some online apps and devices like Fitbits that you can use, and these can help you to aim for 10,000 steps each day. It is also important to train your lungs for the surgery, particularly if you have a pre-existing chest condition. It is really important to make sure that your lungs are fit for surgery as well as the rest of your body. It is also important to make sure that you are well hydrated, as this helps for you to cough and clear any phlegm that you have after the surgery. This slide shows what can happen to your lungs after the surgery. When you have an anaesthetic and a big operation, it can mean that your lungs produce more phlegm, and this can get trapped at the bottom of your lungs, making you more likely to get a chest infection or pneumonia if you struggle to clear this phlegm. We do make sure that we get you up and out of bed and mobile as soon as possible after your surgery, as this helps to loosen the phlegm and make it easier to clear. It will be really important for you to do some deep breathing exercises, and the way you do this is to think about taking a slow big deep breath in through your nose so that your ribs pull out to the side as you breathe in. Hold it for the count of 2 or 3 and then relax afterwards. This might be a good idea to practice before you come in, because the staff will be suggesting that you carry this out hourly after your surgery. It is also important to make sure that you have a really big strong cough, because this will help to clear the secretions and then they can cause you no problems.
Hello, my name is Felicia and I'm a dietitian working in surgery. Prior to your surgery, we need you to adopt a healthy, balanced diet. And by diet, we don't mean cutting calories, as this could lead to a loss of muscle, which is actually the last thing we want. Before surgery, in general, the aim should be to try to maintain a healthy weight. For this reason, we recommend that you weigh yourself once a week to monitor this. A healthy, balanced diet means eating foods high in a variety of nutrients and includes all of the food groups: protein, fat, and carbohydrate. Now I'm just going to talk about these groups in a little more detail. Protein is important for building and repairing tissues, such as muscle and skin, and therefore plays a key role in preparing your body for surgery, as well as in recovery afterwards. For this reason, we recommend aiming to have 2 to 3 portions of protein a day. So that might be at 2 or 3 of your main meals. Good sources of protein include lean meats, such as chicken or turkey, and non-meat alternatives, such as corn or tofu. Fish is also a recommended protein source. The national guidance is to have 2 portions of fish a week, one of which should be oily, as oily fish contains omega-3 oils. Oily fish can include mackerel, sardines or kippers. In addition, eggs, beans, lentils, pulses and unsalted nuts are also good protein sources.
Now, carbohydrates are your body's main energy source and will help to maintain your weight. Starchy carbohydrates such as bread, cereals, potatoes, rice and pasta should therefore be included at each meal 3 times a day. Wholemeal varieties are the best choices for providing the fibre needed for healthy bowels. Dairy products are a great source of calcium, which contributes to strong bones. We recommend having 3 portions of dairy products a day. A portion could be a pot of yoghurt, a glass of milk, or a small piece of cheese. If you need to boost your intake or your weight, drinking extra milk or eating extra yogurts can be a great way to do this. There are some excellent high-protein yogurts on the market currently, including those by Skia and Arla. If you are unable to tolerate dairy products, you could try a calcium-fortified alternative, such as soya milk or soya yogurts. Fruits and vegetables are a good source of vitamins and minerals, and having 5 portions of different fruits or vegetables a day will ensure you're getting a good nutrient intake, as well as more fibre to promote healthy bowels. Fluids are important to ensure that your body is adequately hydrated. We recommend that you aim to have between 6 and 10 drinks a day, and any fluids can count, although low sugar decaffeinated options are preferred. Now, this section might not be relevant to everyone, but if you are underweight, losing weight, or struggling with your eating, now is the time to try to boost your oral intake. A good way of knowing if you're underweight or not is through checking your BMI, which stands for Body Mass Index. This is a calculation of your weight in kilograms divided by your height in meters squared. If this number is under 20, then this would suggest you might be under a healthy weight. Another indicator might be that you're eating far less than you used to eat, or that you've noticed a significant amount of weight loss in the last few months. You might know you've lost weight through checking on the scales, or you might have just found that your clothes and maybe your watch or your jewellery are fitting more loosely. If this is the case, the general advice is to try to boost your oral intake by eating little amounts more often, rather than struggling through 3 large meals a day. So this might look like 3 smaller meals, plus extra small snacks in between your meals. Including milk desserts such as custard, rice pudding or ice cream can help, as can fortifying your foods. And by fortifying we mean adding things like extra cream to fruit, soup or porridge, or adding things like butter or grated cheese to foods like mashed potato and vegetables. Adding these extra ingredients adds extra energy to your foods without filling you up too much more. Having full fat versions of foods such as full fat milk and full fat yogurts can help to increase your energy intake further. Fluid is important, as mentioned before, but fluid can also fill you up without providing you with energy. So drinking milky drinks can really help to provide you with both fluid and energy. You might wish to try things like hot chocolate made with milk, or milky coffees such as lattes or cappuccinos, or you could have something like a milkshake or a smoothie. Just drinking a simple glass of full fat milk is great too. One extra non-food related tip is regarding vitamin D supplementation. Vitamin D has a vital role in post-op recovery as it aids bone healing, muscle function and supports the immune system. The main source of vitamin D is from sunlight, so supplementation is recommended for everyone during the winter months. However, for us in the north, it is worth taking year-round, particularly during this coronavirus period where we are spending a lot more time indoors and aren't going on our sunny holidays. The recommended dose of vitamin D is 10 micrograms or 400 international units per day. Vitamin D tablets can be bought from any large supermarket or pharmacy. For more information about anything I've discussed, please look at the pre-op website, and in particular the document Preparing for Surgery During the Coronavirus Outbreak. Thank you.
You have heard us talk about all of these key areas, and what I'd like to do now is to ask you to take a moment to think about yourself and ask yourself a few questions. How much exercise do you do every day? And do you need to increase this? Are there exercises that you could find to improve your strength and exercises you could do in your home and garden during the time that you may have to isolate before surgery? Do you need to increase the amount of protein in your diet? Do you eat fish twice a week? Do you normally take vitamin D? And if not, can you add it to your next shopping list? Do you need to contact the smoking cessation service or cut down on your alcohol? It's also worth considering organising your family and friends for when you first come out of hospital. To start with, you won't be able to do everything that you normally do now, and it's worth getting them organised with all the domestic tasks to give you help and support for when you first come home. We're now moving on to talk about what happens to you after your surgery. For some of you, you will go to the ward afterwards and be looked after there. For other people, you will need to go to the critical care unit. The critical care unit is also known as a high dependency unit, post-operative surgical unit, and also includes the intensive care unit. In critical care, the nursing staff are able to monitor you more closely, and after major surgery and people who have significant health problems, then this may be required. Kirsty Allen, one of the specialist nurses in critical care, is about to talk to you about the unit, but everything she is about to mention is just as relevant if you're going to the ward as well, in terms of helping you with your post-op recovery.
Hello, my name is Kirsty Allen. I am one of the senior sisters on the high dependency unit, and I will be involved in your care when you come to the unit. I work with a team of very experienced nurses, and together we will help to provide the care that you require following your surgery. It's really important that the day after your surgery that you actually get up out of bed and that you mobilise and sit out for not a long period of time, but at least a short period of time. This will help to prevent you from getting a chest infection. It's also really important that while you are with us on the high dependency unit and following your discharge from us, that you brush your teeth at least daily. This also helps to prevent any chest infections. For you to be able to get out of bed, you need to feel that you can do this, and your pain needs to be managed well. If you're in pain, it is harder to get out of bed, and it will prevent you from actually doing what we need to do for you. Whilst you're out of bed, it's also really important that you do the coughing and deep breathing exercises that Nikki, the physio, spoke to you about on a previous slide. For this, also, you need to have really good pain management, and if you are in pain, you need to let the nurses know, because we can help with this and we can give you more pain relief. We manage pain in different ways, and your anaesthetist will decide which is the best form of pain relief for you. If you would like to know more about the different types of pain relief, you can visit the pre-op assessment webpage by googling STH pre-op, and this will give you further information. You are now going to watch a video about your stay in critical care. Thank you.
Hello, my name is Emma.
Hello, my name is Shirley. We are sisters here on the critical care units.
Welcome to critical care. You are planned to come to the high dependency unit or post-operative surgical unit following your surgery. This short film is aimed at giving you an insight into what to expect after your surgery and the journey you will experience whilst you are here.
During your stay with us, you will meet several members of staff, all with different roles. They are all here to ensure your well-being and safe recovery after your operation.
On your arrival, you will be greeted by your nurse and doctor from the unit. You may hear doctors and nurses discussing you and your operation. This is so the nurses and doctors are aware of your individual circumstances and can therefore care and treat you appropriately. You may hear discussions like this throughout your stay.
You will be attached to monitoring and equipment while you are on the critical care units. You will have stickers on your chest attached to wires, a clip on your finger, possibly a cuff on your arm, a cannula into your hand or arm, and oxygen over your mouth and nose, and a urinary catheter. This is to record your blood pressure, heart rate, breathing rate. We will be taking your temperature regularly, and these are known as your observations. These will stay in place throughout your stay. They will be removed as you recover and are getting ready to be transferred back to a general ward.
Being admitted to critical care may seem daunting and overwhelming due to all the equipment we may use.
The monitors can be noisy and different alarms may sound. Please don't be alarmed, these are for nursing staff.
Please be reassured that this is normal practice to ensure your well-being and recovery. To alleviate any anxieties and concerns you may have prior to your admission, we aim to show you some of the treatments and side effects you may or may not experience depending on your surgery.
Our aim is to ensure you are as pain-free as possible and comfortable as possible throughout your stay. After your operation, you may have a device to use. These are known as PCAs or patient-controlled analgesia and PCEAs, which are patient-controlled epidural analgesias. You'll be given a button which delivers pain control. You will be in control of your own pain relief. You will be shown how to use it. Not all patients are offered these. However, nursing staff will ensure you are given adequate pain relief throughout your stay. Medications will be given at different times during your stay, either by mouth, through a cannula in your arm or a line in your neck. Intravenous fluids will be also given throughout your stay. Nausea, feeling sick and vomiting can be common after an operation. There are many medications that can be given to aim to eliminate these symptoms. Nursing staff and doctors will be regularly taking blood samples from you. This is often from an arterial line that will have been placed in theatre. Depending on the type of surgery you have had, you may have a drain or a number of drains from your operation site. These are placed by your surgeon and are there to drain bodily fluids and blood away. You may be required to have different types of oxygen therapy. Do not be alarmed by this. We often use this as a preventative therapy to aid any complications after your surgery. Some of the oxygen therapies we use may differ depending on your surgery and oxygen needs. Depending on the type of surgery you have had, you may not be able to eat or drink as normal. Your surgeon will discuss this with you before your operation. If you are unable to eat and drink, you may have a tube placed in your nose that goes down into your stomach. This is known as a nasogastric tube. You may receive nutrition liquid diet via this tube. This can be used to feed you until you can eat and drink again. Nursing staff will be requesting that they reposition you whilst you are in bed, even during the night. This is all a necessity to ensure your skin isn't getting sore, and nursing staff will look at your operation site and any drains you may have.
We encourage a daytime and nighttime routine on the unit. During the day we encourage a morning wash or bed bath, regular meals and drinks, if you are allowed, and visits from your family and friends. During the night hours we turn down lights and close window blinds to help aid sleep. However, due to the continuous monitoring and nursing interventions, some patients struggle to rest and sleep. If you have any aids you use to help you sleep at home, such as books, headphones, iPads, earplugs, please bring these with you. Acute confusion, also known as delirium, is not uncommon in patients after surgery. If during your stay you begin to experience any signs of confusion, or as a family or friend you notice signs of this behaviour, you should mention it to your nurse, who will reassure you and your family. Depending on your recovery and instructions from your surgeon, our aim is to get you out of bed and sat in a chair. This may seem early to you, however research has proven that early mobilisation enhances recovery time. To help with your circulation while you are in hospital, you may have to wear TED stockings, which are tight, long socks, or floatrons, which pulsate around your legs. Once you are no longer requiring critical care, you will be transferred back to a general ward. They will continue to care and treat you until you have recovered. They will assess and assist any requirements needed for discharge home. We hope this short film gives you an insight to what may happen throughout your journey in critical care. We look forward to caring for you after your surgery.
Thanks for listening.
When you first go home, you'll still have a very long way to go in terms of recovery back to normal life. The in-hospital stay gets you over the worst of it, but you'll not be able to do what you previously did at home to start with. It can take weeks and weeks to get back to normal. Most people want to be on the bike in the top of that picture and just race to the finish line. The reality is it's more like the bottom picture where there's ups and downs, there's good days, there's bad days, there may be some setbacks, and you'll have days where you need to rest and recover, and you'll have days where you feel a bit stronger and you're able to start getting back to activity and normal life. We recommend all the things you did before surgery to continue doing after in order to give yourselves the best chance of full recovery. So here's a final reminder of the 4 key areas that we would like you to think about before your operation. I'm going to focus now on psychological support. We know that people who are in good mental health and well supported do tend to have a better recovery. Anxiety and depression before and after surgery are incredibly common. Some people can manage this with the support of their family and friends and may need the help of their GP. But there are some other services available to you. The first I'm going to mention is Sheffield Iapt, which stands for Improving Access to Psychological Therapy. You can find this on the internet, but they also have a telephone number where you can phone them for one-to-one advice as well. If you happen to have a cancer diagnosis, then the other place that is incredibly supportive and helpful is the Western Park Cancer Support Centre. You do not have to be a patient attending Western Park in order to use this service. They offer support regarding your cancer diagnosis and information, but also health and wellbeing advice and financial advice. You can find information for this by googling Western Park Cancer Support Centre, but there's also a link to this service from the pre-op assessment webpage in a leaflet called Preparing for Major Surgeries During the Coronavirus Outbreak. The pre-op assessment webpage is well worth looking at, as well as there is a huge amount more information complementing what we've been talking about in this video, and also about anaesthetic choices and pain relief options as well. It's easy to find the pre-op assessment webpage by googling STH pre-op